Okay, good morning. Today we will continue with our presentation on the signs of the chest. Today will be the part 2. First, let's see this sign and what does it mean. The hilum overlay sign and hilum convergence sign. It is very important sign to know about, especially if you are seeing something on the hilum. The question is this lesion within the hilum or anterior or posterior to it? Yani, is it paravertebral or is it parasternal or within the hilum? The hilum overlay sign will help us with that. If you can see the hilum vessels through the mass, do you see the hilum vessels here? We can see it. So it means it is not in the hilum. If you cannot see the hilar vessels in the mass, this means it is in the hilum. ببساطة, simply it is silhouetting the hilum. Okay? For example, in this case, when you take the lateral chest X-ray, it's something anterior, here.
It is either anterior
Or posterior. Anterior or posterior, yes, we cannot know whether it's anterior or posterior, but it is not within the hilum. This is the important thing. So when we did CT scan for this patient, there was this thing here, which is this thing here, and it was a thymoma. Okay? So again, a mass in the hilum will obscure the vessels of the hilum. If the hilar vessels can be seen, the mass cannot be in the hilum. Okay? If you don't see it, then it is within the hilum. Like the difference between this one and this one. This one, you can see it. This one, you cannot see the vessels within the hilum. Again, for example here, what do you think? The mass is within the hilum or outside the hilum? This mass, this big one? Within. You cannot see the blood vessels and the pulmonary artery and things like that within the hilum. So when we did the CT scan, and you have this big mass encasing the hilar vessels, of course this is a lymphoma, definitely. Encasing the hilar vessels. Okay, so the hilum overlay sign is important here. What about this? This one. Outside or within? Do you see the vessels? So no, there is a vessels here. You can see it here and here. Branching. I don't know that. Yeah, it's obvious. These are vessels within the hilum. So this is outside the hilum. And when we did a CT scan, we obviously see this mass here in the left para-aortic, paravertebral region. Okay? And it was somewhere here on the lateral chest X-ray. What about this one? Within or outside? We cannot see any vessels, so it's within. And when we did the CT scan, you can see this mass here that is extending from the hilar region to the anterior part and even to the right side of the heart. Okay? It's a big mass. Sorry? Yeah. Okay. Again.
The same convergence sign, the same as hilum overlay sign.
Yeah, it's the same thing. If you see the convergence of the blood vessels, this means it is not within the hilum. Again, you can see this lymphomatous mass here reaching the hilum, obscuring the hilar vessels on the chest X-ray. Okay? Another example is this one. You can see the mass here is within the hilum and here completely obscuring the hilar vessels. You cannot see anything here. Okay? Now, what is another mass that is also very important for us in a daily practice basis is the cervicothoracic sign. Cervicothoracic sign, what does it mean? Anyone had any idea?
Any mass above the clavicle is posterior.
Okay. Any mass extending above the clavicle is?
Not posterior.
Well, you've said the same idea.
It's not anterior.
Yeah. If the borders of the mass fade above the clavicle, if you see the border of the mass disappear above the clavicle, okay, it is anterior mass. If the border above the clavicle is sharp, very well defined, then it is middle or posterior. Okay, يعني the difference here, this is the clavicle, okay, the border above is not well seen, okay, indicating it is anterior. Most of the times it will be thyroid, retrosternal thyroid, okay, the vast majority of the time it will be retrosternal thyroid goiter. While if the borders above the clavicle are well demarcated, it means it's surrounded by lung, يعني middle or posterior. This is the cervicothoracic sign. For example here, where do you think this mass is? Anterior or posterior or middle? خلينا نقول anterior or middle posterior? The border above the clavicle, what? Fades. Here, the border above the clavicle, is it well seen or fade? It is above the clavicle is well seen here. Not because I said fade, it means to fade. You give me your idea, your opinion. This mass, it is in the posterior mediastinum. It is well defined above the clavicle here and there because it is surrounded by lung here and there. Get it? This is the main idea. Look here. This mass, this mediastinal, big mediastinal mass, extends above the clavicle. The upper border here, above the clavicle, well defined or poorly defined? This, not the superior part. This part, the part above the clavicle, it is well defined. So it is surrounded by lung. So it is middle or posterior mass. As you can see here, the same patient was imaged. It is behind the bronchus. Okay? I'm not talking about differential diagnosis. I'm talking about localization. You see the chest X-ray and you know where is the mass.
If you give us the diagnosis better. For example, this,
I think this is most likely could be a lymphoma or some paraspine. I don't have a pathological diagnosis really. It's just the demonstration of the sign, to be honest. Anyway, what about this one? The part above the clavicle is well defined or ill defined? Sorry?
Well defined, it's anterior.
Above the clavicle here and there?
this is not above.
This is anterior.
I think it is posterior because this border, the lateral borders here are well defined. Okay? So it means this is surrounded by lung. Don't look at the upper, the apex of the mass. Look at the lateral parts of the mass. Okay? For example, let's take another one. For example, here. What do you think here? Can you see the lateral borders of the mass here? We cannot see it, indicating
On the left side.
on the left side you can, but on the right you can't. And if you look carefully, you can see the trachea markedly deviated. So this goes more with retrosternal goiter. It's above the clavicle, it's anterior, it is causing some mass effect on the trachea. Okay? Again, what do you think? Sorry? Again, it is well defined here, very well defined. Okay? So goes with a posterior or middle mass. Tamam? Now, another sign is the spine sign. Spine sign, what does it mean? In a lateral chest X-ray, as you go down, the spine becomes more obvious, more lucent. You see it better. You see it in more details. Like you go from up, it's not very well demonstrated. As you go down, it becomes what? More
More black.
black. Exactly. So if this does not happen, indicating there is something at the posterior lower part making the density of the spine increase. For example, here you can see when you go down, it's less, more black, and then increased density, indicating there is something here.
It's the reason that spine in the lower part is more black is that the lung is more thick in the lower.
Exactly, there is more air. Yeah,
More air.
there is more air in the way, making the X-ray penetrates more, give you more details. Okay. Well, this is a very interesting sign. This is the nursing home with a dead end. When you reach it, it's dead end. Okay. Again, no swimming because there are crocodiles. Water on the road during rain. Usually, stupid signs. Anyway, this is another sign called ring around the artery sign. Exactly. It is a sign of pulmonary interstitial emphysema with pneumomediastinum. When you see this, the artery, and there is a ring of hypodense. Sorry? Exactly, sorry. There is a hypodense ring surrounding the artery. Like, for example, here, you can expect to have pulmonary interstitial emphysema or pneumomediastinum. Like in this case, for example, you can see multiple ring around an artery sign here and there. Okay, and when they did the CT scan, you can see the interstitial edema surrounding the pulmonary vessels. You should also keep these signs in mind. Okay, بس وإذا واحد خلص الوقت قولوا لي ماشي؟ يعني. Now, another sign that is, I think, one of the famous signs is the deep sulcus sign. Okay, what does it mean, this deep sulcus sign? It's a sign of pneumothorax. How do we see it? How do we interpret it? First, it is on supine chest X-ray. It is not seen on erect or PA, the usual standard chest X-ray. It helps us to detect pneumothorax on the supine chest X-ray. That is, the patient is very ill, very tired, most of the times in the ICU, most of the times portable chest X-ray. You see the deep sulcus sign. What does it mean? You see the sulcus on one side so deep and so well defined in comparison to the other. Why is that? Because when the patient is supine, the air will be in the upper part of the chest and it will portray the costophrenic angle, giving you this appearance. You will not see the usual pneumothorax that you see in the erect chest X-ray, the pleural line and lack of vessels lateral to it. You see as a more well-defined sulcus.
The apex become dependent and the lower part become non-dependent.
Exactly. Okay, like you see here, this sulcus is much well defined than this one. Okay, for the first look you might say it's normal, but if you look carefully, this is much more sharper and deeper than this one. And when they did a CT scan, and you can see, yeah, you can see the pneumothorax here. Okay? Any question, anything, any comment? Again, another example. Very ill patient, you can see multiple ECG leads on the chest, indicating he's in a critical condition. There is increased lung opacity, and compare this with this. This sulcus with this. This is much deeper and much more relatively well defined compared to the right side. Tamam? So when you do a lateral decubitus view, you just turn the patient laterally and take a lateral view, you can obviously see the air will be up and you can easily see the pneumothorax. Sorry? This one? Yeah, sure. There's a pleural. I not say hemonium. I said pleural effusion with pneumothorax. It might be blood, might be pus, might be chyle, might be whatever. There is a fluid and pneumothorax. You can see the air fluid level here. Okay? And when the patient is supine and they take the X-ray, this fluid was flat posterior to the lung. That was caused the diffuse increased density of the lung. This is called the veil sign. Veil اللي هو الشال. It's like someone is wearing shawl on his hemithorax. Okay, this is another sign. Now, another sign we have here is the Cheerio sign. Cheerio, it's some sort of شايفين الكورنفليكس هذا الجهالي ترى يقوم for breakfast of children, you know, it's Cheerios, called the rounded small things. You can see here and there multiple rounded things like looks like Cheerios here and there and there. Okay, so like this is the Cheerio. So they are small cavitary nodules resembling the breakfast cereal, indicating eosinophilic granuloma. The nodules are cavitating, also can be seen in bronchoalveolar cell carcinoma, called the Cheerio sign. So when you see that, you have to be on the safe side. You have to remember it might be either alveolar cell carcinoma with cavitation or cavitating eosinophilic granulomas. You need to take more history from the patient, and you see the labs and things like that. Okay, so when you see this appearance, it looks delicious, like Cheerio. Keep in mind, carcinoma, bronchoalveolar carcinoma, not so delicious, and eosinophilic granuloma also not a delicious thing. Okay, again, you can see this Cheerio here, very delicious. Another one here. Different severities of the Cheerio side. Okay. This poor guy has a bronchoalveolar carcinoma. He did a double lung transplantation for bronchoalveolar carcinoma. In the recurrent lung, he had a recurrence of the bronchoalveolar carcinoma. Yani, this is the worst luck ever. You can see these are the Cheerios here and there, the rounded cavitating things. And again, on another view, and here, you can see the Cheerios and the pathology had a recurrence in the transplant lung, of course, due to the immune suppression and the radio and the chemo and things like that. All will exacerbate the possibility of developing another malignancy. Okay. Now, this is very famous sign. It is the crazy paving sign. I think we all know exactly what does it mean. However, we will review it again. Crazy paving sign is indicating for alveolar filling process. It's a ground glass pattern with alveolar filling with exudate or transudate or with a fluid. Okay, the differential diagnosis of this sign is what? Number one, alveolar proteinosis. It is very, very highly suggestive of alveolar proteinosis. Other differentials? Sorry? Well, it's more in favor of bronchoalveolar carcinoma or silicosis. PCP infection also can be seen in this, and some others. Some lymphangitis carcinomatosis not in the can be put in the differential diagnosis, but it usually does not present with typical crazy paving appearance. It presents with interstitial septal thickening, interlobular septal thickening. Okay, what do we mean by crazy paving? Crazy paving is this the thing that they make the street with. You see this, okay, like you see in the Citadel, the ground. This is the crazy paving. It looks exactly the same. You see the resemblance. So this what do we mean by crazy paving pattern?
It has two signs radiologically. Ground glass and interlobular septal.
Exactly. It has to be together to produce this appearance. The lines are the interlobular septal thickening, while the increased density of the lung is the ground glass appearance. Okay, it's the airspace opacification. Now, the next sign is tree in bud. This is what we see a lot of these in the CT scans, and these are called tree in bud. What does tree in bud means? It means endobronchial spread of a pathology. Okay, there is. It appears as clustered nodules. Usually they are centrilobular, at the mid-center of the lobule, not the lobe, the lobule. Okay, so resembling this budding branch. You see branch in bud, and it indicates airway disease with endobronchial spread. It means the disease is spread through the bronchioles into the alveoli. The alveoli opacified is the bud, and the bronchiole is the tree. So tree and bud is together. Usually, infection. Keep in mind, always write in the report when you see tree and bud, there is tree and bud appearance, suggesting bronchiolitis. What's the cause of bronchiolitis? That's not your job. That's the clinical, the lab, and the other imaging modalities. You might suggest TB, especially in our part of the world, in the Middle East. It's very common, very recurrent, let's say. Suggest TB if there are other supporting signs, like, for example, cavitating lesions, fibrotic changes, calcified lymph nodes, I don't know, whatever. Also, aspiration can be a cause. If the nodules are larger than buds, they call tree in bloom. This is blooming, okay? It has absolutely no difference. It's the same differential diagnosis, just the difference in the size, okay? Don't worry. So, again, this is a bronchogram. They pushed radio-opaque material, and you can see the bronchus, or bronchiole, sorry, leading to the terminal centrilobular bud, okay? This, when this gets opacified by pathology, results in the tree in bud or tree in bloom appearance.
This is normal.
Yeah, this is normal, just opacified by contrast material.
Dr. Ahmed, if you go to the tree and bud, usually patchy,
Yeah,
not diffuse.
according to the pathology. Could be, for example, if it is aspiration, you'll see it somewhere in the right lower lung lobe. If it is TB, you might see scattered here and there. If it was, according to the cause of the tree and bud. Again, this is another, you can see here, these are bronchiectatic changes, don't worry about it. Just look here, you can see some centrilobular tiny nodules. Again, in the same patient at a different level, you can see these centrilobular nodules, they are this tree in bud appearance, here and there, okay? Again, you can see here, centrilobular faint tiny nodules. If you are suspicious whether it's there or not, tell your technician, or you can do it, increase the slice thickness. Make it thicker cuts to be more obvious. For example, here it's a 5 millimeter slice thickness CT scan. Not very obvious, you are not so sure, make it 7.5. Make a maximum intensity projection, MIP. It will be much more obvious. You can see the centrilobular nodules diffuse all over the lung. You just increase the slice thickness and increase you make a maximum intensity projection to make it more obvious. Okay? I think we will stop here today because it's already 9 o'clock, and we will continue maybe next week, inshallah. Okay?
Next Thursday, we will continue.
According to the time. Thank you very much.